Joining me in the studio for more on this deadly coronavirus, he's a public health physician, Dr. Oluwatomi Adeyemi. Thank you for joining us at this time.
Thank you for having me.
Well, what we dreaded so much is here with us. Just one case for now anyways,
Yes.
but what should the people know?
Okay, the people should know, first of all, that they should not panic. We've been getting a lot of WhatsApp messages that are being forwarded, things that are not true. So they should know that every information they send out to their loved ones, of course, everybody is anxious. It should be from credible sources, either the Federal Ministry of Health, Lagos State Ministry of Health, or the Nigerian Center for Disease Control, first of all. Then they now need to know the preventive measures. For now, they shouldn't bog their heads with a lot of the medical jargons or a lot of the big grammar they might see going around. But the preventive measures, number one, hand hygiene. Good hand measure. Once you wash your hand properly, once it's visibly dirty, proper hand washing, or the use of the alcohol-based sanitizer if your hand is not visibly dirty. Then good respiratory hygiene. Apart from yourself, you need to teach those around you, because you're not going to infect yourself. It's someone around you that's going to infect you if the person is infected. So you need to teach them good cough hygiene, respiratory hygiene. When you cough, you do not cough into your hands. You cough into a handkerchief or a tissue paper and discard immediately. Or you cough into your elbow if you do not have a handkerchief or tissue with you, and wash your hand properly. Avoid crowded areas for now, because now luckily the first case, index case, has been isolated. Contact tracing is going on. We're trying to identify all the people that had contact with this person and follow them up for the longest incubation period of this disease to see if they develop the disease. So for now, we don't know who could be carrying the disease. So you need to be on the alert. You need to protect yourself, proper hand hygiene, good cough etiquette. If you're ill, do not self-medicate. Do not just go to the pharmacy and buy medications off the counter. You need to go to a proper health facility so that you're checked. If perchance you're on the quarantine list, self-surveillance is what is advocated for you. So you're supposed to stay at home and watch yourself for signs and symptoms. If you develop any of the signs and symptoms, you call any of the numbers. We have helpline numbers that you can call and access, and they would come get you and test you.
All right. As it is now, trust Nigerian traders to cash in on whatever is happening. The prices of nose masks have really gone high, and in some stores you won't even find face nose masks. So how helpful actually is face mask on one hand, and what else can people get to actually stay off this virus?
Okay, from countries that have actually contacted this coronavirus, like China, for example, where it started from, we got to realize that using the face mask, because China too is overpopulated, we have almost the same issue as China. Nigeria and Lagos is overpopulated. Lagos alone, we're over 22 million. Everywhere is crowded. A lot of people go through public transport system regularly on a daily basis. So even the commercial bus you're going to is overcrowded. So in order to protect yourself, because it is said that if someone is coughing and you can see, you should stay 1.5 to 2 meters away from the person. That's like your outstretched arm. But if you're in a crowded place, that's not possible. We know that the virus is transmitted through the droplet infection, meaning it goes into air droplets. It can go on surfaces, and when you touch those surfaces, you can reinfect yourself if you touch your face. However, if someone is in close proximity with you and he coughs, talks, or sneezes, you can actually inhale the air droplet. So that's where the mask comes into play, because once you put on the mask properly, because some people put on masks, they put the wrong color out, they don't put it on properly, or they don't fit it well, so you still have spaces in between. So once you put on your mask properly and somebody is in close proximity to you and he coughs, sneezes, and talks, and he has a virus, apart from coronavirus, any other virus, you can protect yourself from actually inhaling this particle. It's unfortunate that our traders or our chemists and pharmaceuticals have decided to exploit Nigeria at this period. So we would implore all those that have access to importing more of these things to help get them in so that they're in circulation. Even our children, as they go to school, we can get the small pocket-sized sanitizers for them and teach them good cough etiquette. If they are coughing, if they are sneezing, not every cough or flu, it's coronavirus. We have the ordinary flu. So they need to know how to wash their hands properly or sanitize if they don't have access to water.
All right, Dr. Oluwatomi Adeyemi, public health physician, thank you for joining us and
thank you for having me. Yeah, thank you.